Welcome back to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, naturopathic doctor. And on today's episode, I'll be discussing postpartum mood disorders. Now, motherhood is a life changing experience. It comes with joys and hurdles and deep transformation in women. And alongside the exciting ups and the challenging downs, it is important to address under discuss issues surrounding mental health in motherhood. Conditions like postpartum depression, anxiety disorders, and even rare cases like postpartum psychosis can overshadow the happiness that should accompany this special and transformative time. Now, a mother's mental health is incredibly important for her child's well being. If a mother is struggling, it can affect how she interacts with her child, and it actually may hinder their development. Now, research shows that a mother's mental health during pregnancy and the first year after childbirth can shape how her child grows emotionally and socially and can make them more vulnerable to traumatic experiences. Overall, we can best support a child's well-being if we support their mother's health. Now, identifying pregnant and postpartum women with depression is important because untreated depression can have harmful effects on women, families, and infants. Now, compared to other health screens during pregnancy, like gestational diabetes, only about 40% of women are screened for depression. Now, here's some awful stats. Compared to white women, women who are African American, Asian, American Indian, or mixed race were less likely to be screened for postpartum depression. And even when screening occurs, not all women will disclose this and seek treatment. Women often mention stigma, lack of time, and lack of motivation as reasons of why they don't seek care. Similarly, women are also hesitant to share personal information because of the concerns of being judged, fear of involvement of child protective services, and negative interactions with healthcare professionals. Risk factors for perinatal mood and anxiety disorders include perinatal loss, experience of intimate partner violence, and a history of mental health issues. In addition, certain groups are more likely to experience perinatal mental illness. These groups include, but are not limited to, individuals who are racialized minorities, immigrants and refugees, adolescents, and 2S LGBTQ plus individuals, as well as those living in poverty, experiencing unstable housing and food insecurity, and actively using substances and or experiencing addiction. Now, during pregnancy, a person has regular contact with the healthcare system, and perinatal care providers might be the patient's first point of contact with it. In addition, they may be the first healthcare provider to establish a trusting relationship with. Now, this allows healthcare providers to play an important role in identification, screening, and referral for perinatal mood and anxiety disorders. Screening should typically happen in pregnancy around the 28th week and again in the postpartum. Now, if someone is noting distress in between these times, though, screening is encouraged at that point in time. Now, before we dive into some more of the common postpartum mood disorders, I want to take a minute to chat about the pregnant person's partner. Research shows that women typically value the support of their partner above all, and having their support plays an important role in overcoming obstacles to seeking help. When a woman has a strong support network, it can lead to better health outcomes for the mom and the family unit. Now, if we can educate partners about postpartum depression and other mood disorders, perhaps it will make them more likely to recognize the symptoms in postpartum women. This increased awareness might help to tear down the barriers in accessing care and result in the follow up and treatment for the mother. And this ultimately might lead to better outcomes for her and the well being of her family. Next season, I'll be discussing paternal postpartum depression, as the symptoms often present differently in men, and a male partner is more likely to experience postpartum depression if their female partner has postpartum depression. Now, moving on to the postpartum mood disorders. In the first 2 weeks after birth, up to 76% of new parents might experience baby blues, which can manifest as mood swings, heightened anxiety, tearfulness, and sleep disturbances. If these symptoms persist beyond this period and begin to interfere with daily activities, it might be necessary to consider postpartum depression as a possible diagnosis. Postpartum depression is defined as a major depressive episode that begins within the 4 to 6 weeks after delivery, but may still occur for those first 12 months. Signs and symptoms of postpartum uh, depression might include persistent feelings of sadness, changes in sleep patterns, either more sleep or less, a loss of interest in activities that they had previously enjoyed, feelings of guilt or hopelessness, decreased energy levels, difficulty concentrating, changes in appetite, agitation or slowed movements, and thoughts or actions related to suicide. Risk factors for postpartum depression include, and this is the strongest predictor of postpartum depression, is a personal or family history of depression, including postpartum depression. And the second strongest predictor is adverse childhood experiences. Then other risk factors include fetal or newborn loss, substance abuse and or dependence, pregnancy or birth complications, baby health challenges, unplanned pregnancy, and intimate partner violence. After giving birth, some individuals may experience postpartum anxiety characterized by concerns such as imagining worst case scenarios about childbirth or their baby's well-being, doubts about their ability to parent, and fears about their baby's safety. Symptoms include excessive worry, difficulty sleeping, loss of appetite, muscle tension, irritability, and might mistakenly be attributed to the normal stresses of pregnancy or adjusting to parenthood. Risk factors for postpartum anxiety include a personal or family history of anxiety, life changes or stress, a lack of social support, health challenges for mom or baby, poor sleep, depressed mood, intolerance of uncertainty, or adverse childhood experiences. Postpartum psychosis is rare, but is a medical emergency that can manifest a few hours within to a couple days after birth. It's characterized by abrupt shifts in mood, paranoia, delusions, disorganized actions, and impaired cognition. The lack of awareness and psychotic symptoms can put both the mother and her child at risk. Individuals who suffer from postpartum psychosis often have a background of bipolar or schizoaffective disorder, and risk factors for postpartum psychosis include bipolar disorder, a history of psychosis, postpartum or other, family history of psychotic illness, sleep deprivation, or discontinuation of their medication. Now, depending of the severity of illness and individual preferences, different treatment approaches or intensities might be required. For pregnant or postpartum patients with moderate perinatal depression or anxiety, you might notice that psychoeducation, psychotherapy, pharmaceuticals, or a combination of these approaches are the first line treatments. In the show notes and resources, I've provided some information about Toronto based psychosocial and community based supports. If medication is needed, most of them used to treat perinatal mood and anxiety disorders are not teratogenic. Your healthcare provider who prescribed the medication should be having a comprehensive discussion with you about the benefits of the medication, as well as noting any side effects of beginning, continuing, or changing medications. Now, if you're going into pregnancy with a pre existing depression or anxiety, that is well maintained with medication, you should likely not abruptly discontinue it during pregnancy. Be sure to have a conversation with your mental health clinician or obstetrical care provider before you consider discontinuing or tapering medications during pregnancy. Thank you so much for listening to this episode of Postpartum Mood Disorders. I hope you found it informative. If you did find this episode helpful, please subscribe to this podcast, leave a review, or follow me on Instagram. Thank you so much, and I'll talk to you next time. Take care.